If you've noticed an itch creeping across your calves, shins, or ankles, especially in the evening or after sitting for a while, this could be a sign of poor circulation. More specifically, peripheral artery disease, PAD. PAD is a condition where the small blood vessels in your lower limbs start to narrow, reducing blood flow. This limited circulation can cause your skin to become dry, thin, and sensitive. And yes, itchy. It may be tempting to assume it's just dry skin, but if lotion isn't working, and there's no rash, eczema, or allergy, it could be something deeper. Let's compare to common cases. Harold, age 82, walks daily, checks his legs regularly, and feels energized. Dennis, the same age, sits for long stretches, feels tired, and recently began experiencing itching on his lower legs, especially at night. Dennis applies cream, but nothing changes. What he doesn't realize is that his itch may be a vascular symptom. When blood doesn't circulate well, the skin loses moisture and elasticity. The tissue beneath weakens. Over time, this impacts your heart, brain, and immune system. It's also worth noting that your legs are often called the second heart, because they assist in pumping blood back up to your core. If your legs are suffering, your entire cardiovascular system may be under strain. The silver lining: this condition can often be improved naturally. Short daily walks, even 10 minutes. Hydration: compression socks, approved by your doctor. Lowering salt intake. Elevating feet when sitting. If the itch in your lower legs persists, even without visible signs, don't dismiss it. It might be your body asking for better blood flow. If you're over 60 and frequently feel an itch in the middle or upper part of your back, especially at night, you might think it's just your shirt tag or dry skin. But when moisturizing and fabric changes don't help, it could be a signal that your internal organs, particularly your liver or kidneys, are under stress. You see, your liver and kidneys are responsible for filtering out toxins from your bloodstream. When they're functioning well, your body maintains balance. But when these organs begin to slow down due to aging, medication overload, or dehydration, toxins can accumulate in your blood. This often causes the skin to become irritated and itchy, especially in places with high nerve sensitivity, like the back. Let me tell you a story about two women, Dorothy and Janice, both 76 years old. Dorothy maintains a healthy routine. She drinks plenty of water, eats clean, and gets regular checkups. Janice, however, has started feeling unusually tired and bloated. She's noticed swelling in her ankles and a strange itch on her back, mostly at night. She's tried changing soaps and applying moisturizers, but the itch persists. What Janice doesn't know is that her symptoms might not be skin-related at all. They may be rooted in kidney or liver dysfunction, and this is more common than people think. Why liver and kidney problems cause itchy skin? When the liver or kidneys are struggling, waste products build up in the bloodstream. These byproducts, like urea or bile salts, can irritate the skin from the inside out, especially in sensitive areas like the back. It's an early warning sign that your body is trying to detoxify itself, but can't do it effectively. This type of itch is usually persistent and long-lasting, not relieved by scratching or creams, not accompanied by a visible rash. Worse at night. And while the itching itself isn't harmful, it's what it represents that's the real danger: a decline in detox function, which can impact your digestion, energy, sleep, and mental clarity. Silent but serious: organ decline and lifespan. Studies show that chronic liver or kidney dysfunction can go unnoticed for months, sometimes years, before reaching a critical point. And in seniors, this quiet decline has been linked to increased fatigue, poor sleep, decreased immunity, higher risk of stroke, heart failure, and cognitive decline. So if your mid-back itches at night, and you're also noticing fatigue or swelling, it's time to pay attention. What you can do today. Fortunately, many of these issues can be detected early and managed with simple steps. Schedule blood work to check liver enzymes and kidney filtration rates, e.g., GFR. Drink enough water, especially if you're on medications that tax the liver. Cut down on processed foods, alcohol, and excess salt. Review medications with your doctor for possible liver, kidney side effects. And remember, hydration and nutrition aren't just about energy. They're essential for maintaining healthy filtration systems, your body's internal cleaning crew. So, the next time your upper back starts itching for no obvious reason, stop and listen. Your skin might be whispering about an internal problem long before it becomes visible. Don't ignore the itch. Investigate it. Of all the places on the body where itchiness shows up, the scalp and neck might seem the most innocent. We often blame it on shampoo, dry weather, or sensitive skin. But for seniors over 60, persistent itching in these areas may reflect something much deeper: chronic stress, nervous system fatigue, or even early cognitive strain. The nerves around the scalp and the back of the neck are especially sensitive. They're among the first areas to react when the body is under psychological, emotional, or neurological tension. And unlike other kinds of stress responses, like tension headaches or anxiety, this one can show up as something deceptively simple: an itch. Let's look at two gentlemen in their late 70s, Leonard and Ray. Leonard enjoys gardening, light meditation, and weekly family dinners. His days are slow, meaningful, and calm. Ray, on the other hand, has struggled with adjusting to retirement. He finds himself restless, glued to the news, and alone most of the day. Over time, he developed a persistent itch on his scalp and neck. No flakes, no rash, no allergy, just an urge to scratch. He changed shampoos. He bought a silk pillowcase. Nothing helped. What Ray didn't realize is that his itch was not a skin issue. It was a nervous system distress signal, the itch of chronic stress and inflammation. As we grow older, our body's ability to manage stress diminishes. The nervous system becomes slower to reset, and cortisol, the stress hormone, can remain elevated longer than it should. This prolonged stress state leads to increased skin sensitivity, suppressed immune function, poor sleep quality, heightened inflammation. All of this can show up in the most subtle way: an itchy scalp or neck. Medical studies have linked chronic scalp itching with neuropathy, anxiety, and even early cognitive decline. It doesn't mean you're developing dementia, but it may be a sign that your nervous system is overloaded and your emotional resilience is under pressure. How to soothe the nervous system and the itch. The good news is, this is often reversible with small lifestyle adjustments. Unlike circulation issues or organ dysfunction, stress-related itching responds well to behavioral and emotional support. Here's what Ray did, and what you can do too. Spend time outdoors, ideally in the morning light. Turn off the news at least 1 hour before bed. Connect with someone weekly, even a quick phone call. Practice 5 minutes of deep breathing before sleep. Write down 3 things you're grateful for daily. After a few weeks of consistency, Ray noticed his itch began to fade, not instantly, but gradually. As his inner tension released, his skin calmed down too. When to seek help. If your scalp or neck itch has lasted longer than 2-3 weeks, is not responding to topical treatments, is paired with mood swings, sleep issues, or forgetfulness, you should talk to your doctor. It may be a sign of early neuropathy, thyroid imbalance, or psychological stress that needs support. Your skin is reacting not just to what touches it from the outside, but to what you carry on the inside. Coming up next, we'll explore a surprising area where itching may reveal a different kind of imbalance: your chest and abdomen. And it might have everything to do with the way your body processes food, absorbs nutrients, and protects itself from disease. Let's finish strong. Your body's wisdom is just one more itch away. When it comes to health concerns, most seniors look out for high blood pressure, joint pain, or memory lapses, but very few consider that a persistent itch on the chest or abdomen could be a serious signal, one tied to nutrition, digestion, and internal repair mechanisms. As we age, our bodies naturally become less efficient at absorbing vital nutrients. Appetite decreases, digestion slows, and even when we eat enough, our cells might not be getting what they truly need. This can lead to something called malabsorption syndrome, and one of its first, most overlooked symptoms is chronic itchiness in the torso. Let's meet two women, Both 81, Joyce and Elaine. Joyce eats modestly but consciously. She includes leafy greens, fruits, and some protein in each meal, even if they're small. Elaine, however, has lost her appetite over the past year. She skips meals, snacks on crackers, and often feels too tired to cook. Lately, she's noticed her chest and stomach feel itchy, especially in the evening. No rash, no allergy, just a strange dryness and discomfort. What Elaine is experiencing is more than just skin irritation. It's likely a nutritional red flag. The nutrient-itch connection. Vitamins like B1, zinc, magnesium, and essential fatty acids are all necessary for healthy skin and proper nerve function. When these are lacking, the skin becomes dry and hypersensitive. Nerve signals get erratic, leading to tingling or itching. The immune system weakens, making recovery from small irritations much harder. Itchy torso skin, especially across the chest and belly, is common in seniors with hidden deficiencies. What's dangerous is that these deficiencies don't always show up on a blood test unless specifically requested, and many seniors remain normal weight while still being undernourished. This is known as hidden hunger, and it silently contributes to muscle loss, fatigue, weakened immunity, brain fog, and poor concentration. What you can do today. The good news. Nutritional issues are among the most reversible causes of chronic itch. Here's how you can start nourishing your body back to balance. Add a daily multivitamin approved by your doctor. Include healthy fats like olive oil, nuts, or avocado. Reintroduce simple proteins like eggs, yogurt, or legumes. Snack on zinc-rich foods like pumpkin seeds or lentils. Hydrate more. Dehydration is often mistaken for hunger or skin dryness. You don't need a complete dietary overhaul. Start small. A boiled egg in the morning, a few almonds in the afternoon, berries or a banana before bed. These tiny additions can restore what's missing and reduce inflammation from the inside out, so the itch fades naturally. Your skin, your mirror. It may surprise you to hear this, but dermatologists often say, the skin is the mirror of your gut. When your internal system isn't absorbing or processing well, your skin will reflect that. The chest and abdomen, being rich in nerve endings and blood vessels, are often the first to show it. So if you've been struggling with a mystery itch across your torso, especially paired with low appetite or irregular eating, listen to your body. It's not nagging you. It's nudging you toward healing. Final thoughts, small itches, big insights. By now, you've learned how for specific itchy spots, your legs, back, scalp, and torso may be quietly telling you about circulation issues, organ strain, nervous system fatigue, nutritional gaps. These aren't just isolated skin symptoms. They're early health alerts, whispering that something inside may need care. But here's the best part. None of these signs are irreversible. You can move more, eat just a little better, breathe a little deeper, connect a little more often. And in doing so, you're not just scratching the surface. You're building a stronger, clearer, longer life from within. Thank you for staying with us to the end. If you found this helpful, don't forget to like, share, and subscribe. Your body is speaking. Let's keep learning how to listen together.